The title of this session is called, What is a Health Data Ecosystem? And if you're like me, you probably ask yourself, what do we mean by a health data ecosystem? And if you remember that in her first presentation, Natasha said that one of our challenges, the very first challenge at the beginning of this pandemic, was realizing that we didn't have definitions of some of the data, and we lacked clarity and consensus on the metadata. So before we have this session, we wanted to ask you, what do you think a health data ecosystem is? And we've given you 4 potential metaphors. Do you think it's a jungle? Is it a mess? Is it a smooth, calm lake with beautiful views? Is it a garden with lots of different plants growing in it? So we're inviting you to think, when you hear the words, what is a health data ecosystem? What is the image that springs to mind? And of course, remember in our first presentation from Natasha, she talked about the challenges is that the data was late in coming in. A lot of it still persistently sitting in silos. We don't have consensus on what type of data, how we collect it, what we use it. And so I don't mean to bias your polls, but I can see that a mess is still quite a popular option there. It's more as well head to head with the garden and a jungle. Some people see it as a jungle, of course.
And surprisingly, the lake seems not to be so favored. While a lake has a surface, but has also a volume underwater.
True, exactly. And there's the famous message that we say in English, which is you see the beautiful swan on top and it's just moving and gliding along. What you don't see is underneath the legs frantically moving.
Exactly.
So often in a data system, you have lots of moving parts that need to happen together. So we're going to close this poll in a second, and we can see here that the winner was definitely a garden, followed by a mess, and followed by a jungle with all of the fertility and noise of a jungle, but also the difficulty of walking it through it. We have someone on the chat who said actually they see it as a jungle garden in a lake surrounded by a mess. So clearly there are parts that seem to be working, parts that are clear, and parts that are just too dense to go through. So we gave you a difficult choice. We asked you to come up with one of them. But now let me turn over to Jaana Sinipuro from Sitra, who is going to describe for us her vision of what she thinks a health data ecosystem would be, a healthy health data ecosystem even. So Jaana, thank you for giving us a few moments to just carry that out. And as you can see, sadly not many people going to the lake, the smooth environment. Quite a lot of people seeing the health data system in their minds is a mess. Some people seeing it as a jungle, but a garden is coming through as a popular image. So Jaana, let me turn over to you.
Okay, thank you. Yes, I'm myself living in a Finnish archipelago in an old log house with this 130 years old, and I think the garden there is very overgrown. But I also like that garden very much. So I think my garden looks like a garden mess. But I also think that it's a very typical for healthcare because we have so many old structures in place, and I think somehow those old structures are also the source for new growth, because it's very dependent on the trust and those structures that are in the place. But if we find new ways for sharing data, if we find new ways to enrich the soil and enrich the garden, maybe we can make a very good future based on that mess also. But anyway, yes, as I already started, I'm very happy for this opportunity to Sitra to host this session and start thinking about those ecosystems, because I think that we need this new kind of data sharing ecosystems for this complex world. And also, as we just heard, we need new sources of data. We need to act in hours. So we need to have more reliable ways of accessing data from different actors. So that's basically my key message in this presentation. So let's go very shortly into the intro for this topic. I want to put my presentation into the right context. When we are speaking from the Finnish point of view or Nordic country point of view, we live in a society of very high trust. So the ecosystem work that we do in our societies is very much built on a public-private partnership. So there's a very long tradition, governments and citizens working together, and most of the system is tax funded. So I think this is quite exceptional that there's so high trust on the society and public authorities, public social welfare providers. And that was one of the bases how we managed to create the first local legislation based on the GDPR, the Act on the Secondary Use of Health and Social Data, and now there's one centralized national permit authority taking care of use of data. And we are very happy now at Sitra because we have this role in coordinating the joint action towards European health data spaces. You will later hear on that topic as well. But I think that the transparency and trust and more transparency, accountability in data sharing is the way for Europe to build those ecosystems. We cannot replicate one model to all countries. We need to adjust our practices and our solutions to different countries. So currently I work as a project director in Citrus in response to the European data strategy. Fair data economy is our labeling for this European approach to data economy. And we are working at multiple levels with policymakers. We are actually taking also a role in coordinating the national GaiaX hub. So GaiaX is this big driver initiative for companies to work for European health data spaces, and we will have active role there in coordinating our local efforts. So, and also working with skills building at multiple levels. But what we want to build is this new broader European approach to data economy, creating well-being for all companies, citizens, and society. And that's a huge topic. But and also when we started this topic, I think there was still lots of buzz around AI, but we are very happy to see that there's a more and more common understanding that we need to have good practices for data usage as well, and the whole process for using data and developing those AI-based solutions start from the data. So this transparency is needed. But very soon, working with this topic, we also realized that very often we mix those fairness and fair principles together with those key principles for research, fair principles. But in our fairness, we want to create this fair data sharing ecosystems, and thus we start building on common understanding what's meant by fairness. And currently we are doing work in defining criteria for fair data sharing, building on from the European data economy principles and creating maturity models for companies to do self-assessments on how fair they are in their data sharing practices. And I think this is just a very short background, but for achieving this fairness in our data sharing, we need to have, of course, those technical prerequisites in place and data architectures, data governance capabilities and practices, but more and more the values and culture and skills, how we are using the data, how we evaluate data. I think those will be the key differentiations in the future, how we maintain the trust. Then by sharing the data, by combining data from different actors, data holders, we can create new data-driven services and create value for end users. And then we think that then, in addition, if you are willing to donate your data, if you are willing to share your data together with your ecosystems, you will most likely be able to create more relevant services for individuals, more relevant services for patients, and thus the value of the ecosystem multiplies with sharing of data with multiple parties. Because as I started this presentation, in a complex world like this, you can't operate on your own. You need to have expertise from other vendors, other organizations as well. I think there's a move. We are all kind of adjusted to that GAFA companies are the big bad companies also telling us how we should build the future services. But there are more and more research saying that actually for this complex world, for this new playground, we need to go from closed data ecosystems towards open data ecosystems. Gartner is talking about their composable business architectures, and there are more and more needs for this broader access of expertise, and thus to open data ecosystems. But at the same time, we think that this paradigm for data economy is still evolving, and there's this tension between protecting the data and sharing the data. So we need to be very clear and precise on data sharing rules and common code of conduct for data sharing to decrease the risk for data sharing and make it encourage companies for data sharing so that we can create those services. So in a way, we say that we need soft infrastructure that's called data that for building the new services and building these new kind of ecosystems. We used to build, or we don't differ between railways or roads. We all use those. So why should we? There's lots of talks if we separate between personal data, industrial data, or B2B data, or B2C data. We think that data should be treated as a pathway, as a soil, as a ground for those new services to build. So, and that's why we need to create this free flow of data. Of course, when it comes to the healthcare side, we need to be much more conscious about those trust topics. We need to respect the individual rights and sensitive topics. Sensitive use of data has separate requirements in the use of data, but still, I think we need to start thinking about how we can work at policy level, at business skills level, at technical level to make those data flows happen, to create those new data sharing ecosystems. We wrote together with the international round of experts a working paper towards Trustworthy Health Data Ecosystems, where our key mission is to say that we need to enable individuals to be more active co-architects for their own well-being and health and participate in data sharing as well, in data gathering as well. So our definitions for data ecosystem is that it is a group of entities that want to create new business services with each other, want to exchange data for creating those new services, but data sharing should happen only with data owners' permission, with consent from individual if the data is used for individual services. And then we need this work across working towards creating this ecosystem rulebook. That's a soft infrastructure for data sharing that decreases the risks and creates more value for all. And this rulebook starts by going through ethical guidelines, technical, legal, data-related guidelines, and agreeing on which are the terms, the common terms that we can share data for create those better services. So I think we need lots of more structured approach on building those new ecosystems, but at the same time, we need to have those, as innovative minds, we need to come together and innovate for this brighter future. We need to have expertise from business sector. We need to have expertise from policymakers. We cannot work in silos anymore, because these ecosystems that we want to build, they are built on old structures, but in the end, we need to keep in mind that it's actually the patient or customer or end user or me as an individual sitting comfortably in that chair and enjoying about those ecosystem services flourishing around me. So thank you. And yeah.